Hi, my name's Phil. I like talking about politics, and in this video, I'd like to discuss another consequence of the savage cuts to the NHS budget under the guise of austerity, of course. We're now not only going to have to spend way more money on treating people, highlighting the false economy of Tory policies, but an awful lot of that money is going to end up in other countries' economies, and not all of it ours. But first, if you'd like to be notified of daily news and politics, please subscribe to the channel. So, as a result of chronic mismanagement of the NHS, waiting lists are at record levels, over 3 times as long as under Labour, even taking population growth into account. It is way out of kilter. And it also wasn't the pandemic. The rate of increase in waiting lists went up after that, but the waiting lists were rising every year since the Tories came to power in 2010. And you know, this is the key metric. Under Labour, waiting lists went down. Under the Tories, they went up. They talk about the record amount of money that's going into the NHS, but there are a few things to consider here. First of all, they apply fiddles by not referring to real terms increases. Second of all, quite a lot of the money that they say is being spent on healthcare is being spent on healthcare, but not the NHS. They conflate the two. Because remember, a lot of public spending goes on healthcare that is not the NHS. It's private capacity. And also when comparing spending, it really needs to be based on a share of GDP. It needs to take into account of population growth as well. And there's a now fairly well-known series of charts published in the Financial Times last year, which plotted, amongst other things, government spending on healthcare as a percentage of GDP. They show the Tory years in blue and the Labour years in red. So we've got Thatcher and Major's years, we've got Blair and Brown's years, and then we've got Cameron onwards years. Paints a picture, doesn't it? Paints a picture. And the beauty of this chart is it shows other things as well. It compares us. And it shows it right up to the pandemic, but it compares us. It has a range of other comparable economies, and it has a dotted line, which is like the average for the other advanced economies. Under Labour, we went above that average. It took years, but they did it. Under the Tories, it just sank way lower. So global factors can't be blamed either. If other countries can manage better healthcare spending, why can't we? But that's the way past Tory behaviour has left us in the mess we're in now, where we have waiting lists that have gone from just over 2 million to over 7 million. And I want people to understand what the consequences of that are. It means that there are people waiting too long for treatment. That means they are less likely to make a good recovery at all when they get that treatment. It means that while they're waiting for that treatment, their quality of life is hampered, maybe badly hampered for longer than necessary. Even long term, as I say, if by the time they get treatment, they can't make a full recovery, that means they've got long-term health problems now that are going to last a lifetime. It means they can't be as effective in the workplace. That not only potentially hampers their living standards and that of their family, but it's bad for the economy. So any vaguely sensible government, doesn't really matter whether they're left wing or right wing or whatever, any sensible government needs to deal with healthcare. There's an economic as well as a social imperative. Labour have already said that they will use the private sector to clear the backlog. Now, some people don't like this policy, but what's the alternative? Leaving all those people suffering just because of ideology? I will also note that people are saying, oh, this is just increasing privatisation of the NHS. And it's like, no, it's not. Remember what I said. There's in terms of healthcare, there's the NHS and there's private capacity. Now, privatising the NHS is when you take part of the NHS and you say, right, we're going to stop delivering that service as a pure NHS department now, and we're going to use a private company to deliver it instead. That's privatisation. What we're talking about here is just using the private sector to get rid of the backlog. But Labour have also talked about boosting actual NHS capacity as well. They've got policies effectively of increasing nationalisation of the NHS. But the backlog needs clearing. We cannot actually leave people suffering. It's bad for those people. It's bad for their families. It's bad for their communities. And it's absolutely terrible for the economy. And clearing that backlog, which even the Tories are now saying, needs to happen. So basically, even they've worked out it's politically expedient, is going to cost money. A lot of money. Way more money than if we just maintained NHS capacity to meet our needs. The problems that the Tories always have is that they have this warped sense of efficiency. Because healthcare, like a lot of public services, doesn't have static demand through the year. Higher demand in winter, lower demand in summer. Well, I mean, it's lower demand in summer when you don't have a waiting list of over 7 million people anyway. So the Tories looked at the service being under less pressure in summer and thought, oh, we've got too much capacity in summer. Instead of going, okay, we've got less demand in summer, we'll use that as the period where we upskill people in the NHS, get them to do some training. No, they hit upon the idea of reducing capacity so that it couldn't cope in winter. But oh, don't worry about it. You know, we'll clear the backlog in summer. That meant NHS staff would be hard at work all through the year. That is Tory efficiency. But no, it isn't. And the data shows why. Because waiting lists kept going up. We're now in the position of having to pay private companies, not choosing to, as has been happening with NHS services being replaced by private providers. That's bad enough. But now we're just having to pay private providers to clear the backlog. And we're going to have to. I will point out to people who don't like it, it took years for the last Labour government to get the NHS back up to even the average level of resourcing that similar economies had. They did it, but it took, and they only just managed it pretty much before they lost again. The Tories came back in. To insist that we only treat that backlog when the NHS has expanded enough to cope is to condemn people to living with illness and injury without treatment. Because it takes years, even with the investment, it takes years to build up the NHS capacity again. You can't do it overnight. And frankly, it's not the way of any government, certainly not a Labour government, to leave millions of people without healthcare when you can do something to get them healthcare. And it doesn't make sense for any government who understands the economy. Because for me, it's another case of how the Tories simply just don't make sense. Like, I get that their economic views are very different to mine. I can account for that. But they don't make sense. I don't get the attitude. Because, so think about the modern Tories. So, for example, they say, oh, we don't want immigration. Oh, we shouldn't have immigration. We want British people to do these jobs. Now, forget for now that there are more jobs than people in this country, right? British people in this country. Let's forget about that for now. You go, okay. So you're saying you don't want migrant workers, you want British people to do these jobs. But you're also saying you want British workers to go untreated for years, meaning they can't do those jobs anyway. Putting political differences aside, how does that make sense? If you're going to say, we want to just use our domestic workforce and we don't want to use a foreign workforce, you need to make sure that that domestic workforce is working at peak efficiency. That means it is fit and healthy. But anyway, the latest report is that private providers are gearing up to meet this extra capacity need in the UK. So there was a report, AXA, expanding its private healthcare in Britain. Now, of course, we're going to need companies like this if we're going to stop illness blighting people's lives and wrecking the economy. But, and it's a big but, it means shelling out more money on treatments compared with having an NHS that was well resourced enough to meet those demands. It will mean some of those profits leaving the country. AXA is a French company. So not only are we going to pay extra for treatment that would have been way cheaper if the Tories had just maintained NHS capacity and modernised its systems, but that extra money, the profit, some of it's going to disappear to a different economy. It'll be partially used to boost France's economy, and therefore we will be paying for some French public services, because it will be used to swell their coffers. It's ironic to think that the extreme Tory Brexiteers have created the conditions whereby we will be using UK taxes to help boost the economy of our most comparable competitor. Because it's not just AXA. Privatisation of energy means that EDF, the French nationalised energy company, makes money from us and sends some back to boost the French economy. In fact, EDF profits in the UK were partly used to keep energy costs down for people in France during last year's energy crisis. Aren't we nice? Or is it stupid? Sometimes hard to tell the difference. But getting back to the use of private companies to clear the NHS backlog, because there's another downside. Like in the here and now, we need them to get the backlog back down to the point where a properly resourced NHS can cope. Because you cannot build up the NHS to have the capacity to deal with a 7 million strong waiting list, because then it would be too large once you've done it. So we have to build up the capacity. First of all, it would just take too long as well. That is the reality of the mess of allowing the Tories to govern for 13 years and counting. That is the result of that. But then you think about another problem. So we need to build up NHS capacity in parallel with clearing the backlog, right? Okay, so you go, okay. So what does that involve? Well, it involves lots of things. It certainly involves getting more doctors and nurses, paramedics, midwives, everything, really, because we've got shortages across the NHS, right? But also, if these private companies are going to expand to meet this need to clear the backlog, they need staff as well. That's what expanding means. It means hiring more staff. And if we are to boost the NHS back up to adequate capacity, they're going to need those staff shortages reduced as well. Basically, there's going to be a lot of competition for medical staff over the next few years, right? And we're already well short. And you think, so, okay, can we resolve this with a more fit-for-purpose attitude towards immigration? I know Labour is saying, yes, we want to train more domestic medics. Absolutely, yeah, but that takes like a decade before you notice any difference. And if we're going to boost the use of private capacity, that pressure on medical staff is going to remain until we no longer need it. In fact, there's more pressure for people to leave the NHS and join one of those private companies unless the pay goes up pretty smartly. So we're going to need a lot more medics in the country than we currently have to not only make headway on the shortages in the NHS, but to cover the extra capacity needed to deal with the excessive waiting lists. And it's not even like current salaries in the NHS England, at least, because they're more competitive in Wales and Scotland. In NHS England, they're not very competitive compared with other countries. Tough times, and all because we had a government that didn't just have views that I think are wrong, that couldn't see the social, political, and especially economic benefits of accessible and effective healthcare. But there we are. Those are my thoughts. Let me know yours in the comments below. Hope you found the video interesting. If you did, please click the like button. And if you'd like to support the channel further, the join button for memberships. And until next time, I'll see you later.